Hello all, my name is Som Singh. Ellina and Dr. Shipra Singh, we present to you our research study, specifically a case study today, called Concussion Management Through Aerobic Exercise in Marathon Runners. Thank you to the Nostrella Center for Neuroscience for today's symposium, St. Louis University, UMKC School of Medicine, and the Quick Research Institute for all your help in this study. No disclosures, conflicts of interest. So to provide insight, traumatic brain injuries make up a leading cause of death in the United States. In fact, it's estimated that about 1 to 4 million concussions occur annually in the United States. And there's a large number that even go undocumented. So one of the standards of therapy, and specifically in post-concussive syndrome, is rest. Concussion management guidelines promote this to help promote your self-management of your metabolism. However, at the same time, in recent years, aerobic exercise has also been investigated as a form of treatment for post-concussion syndrome. This is really due to that neurometabolic relationship between aerobic exercise and concussion syndrome, which is one of the key areas that we want to explore today by providing a case study, which will give insight to our future large research study. So in our case report, we have a 20-year-old male who presents to the local ED for aggravating headache, light sensitivity, and dizziness. The patient reports being involved in a motor vehicle accident 36 hours prior and even completed a marathon 45 hours prior. Earlier to the accident, the patient states he was driving 40 miles an hour and he was T-boned, unfortunately. At the time of the accident, the patient elected not to go to the emergency department. And on physical exam, they were noted that there are normal limits within his vitals. Cranial nerves are intact. However, he was diagnosed ultimately with post-concussion syndrome, as we see here. So he was given advice to follow standard rest as his treatment. However, in follow-up, the patient expressed that he committed to actually going a daily semi-intensive aerobic exercise regimen because he primarily believed that it would help speed his recovery. 10 days following the MVA, motor vehicle accident, the patient reported that he had complete resolution of the concussive syndromes, and he was actually crediting his exercise regimen. In fact, he even completed a 5K race without any neurologic sequelae. The patient is currently stable. So this introduction provides insight to what our study really is looking at those aerobic effects on concussions. Currently, the pathophysiology is not well known or nor understood. I mean, there's many cascades that go on during a concussion and traumatic injury. So what we look at here is that we see in current guidelines that exercise is being further looked into as a potential therapeutic treatment. So that's the goal of our study ultimately. Thank you all, and I hope you have a good day.